The L spine, the sacrum, coccyx, and then the episigal, which we connect the spine with the pelvis. Okay. So to start the T-spine, it's going to be a 14 by 17 cassette, and then you're going to have 17 vertical, and you only need about 10 inches wide. Okay, maybe a little less, just depends. Your centering point is going to be one vertebrae higher than the chest. Chest is centered at T7, we're centered at T6 here. Easiest way to find that is now instead of 2 to 3 inches below the jugular notch, we're only going to be about 1 to 2 inches, okay? And then a properly positioned one, the reference you can tell, is that you have light field just above the crest that runs from the neck to the shoulder. As long as you have that, you have the connection point for the first rib. Alright, center down the mid-sagittal plane. Want them to be relaxed. You say deep breath in, all the way out, expose on expiration. It'd probably be good to show y'all actually being centered here. You're in the way, sir. No, no. Alright, and then all your APs can be taken with him in this position for the second count. They do not have to move. Because now we're just going to move him up the table to center for the L spine, which is going to be a rough centering like we did for the upper abdomen, which is 2 inches higher than the iliac crest. Okay? So if you just find his iliac crest, it's right there. And you center about 2 inches higher than that. Okay. That is your L spine AP. Also done on expiration. Deep breath in, blow it all the way out, hold, expose. Now the very bottom of your L spine imaging is the mid-sacral line, which is the exact centering we need for our AP sacrum. Our AP sacrum has a 20 to 25 degree cephalic angle. So if you just mark where the lower margin is here, before we get into what the exact centering is, and you angle this to your 20 to 25 degrees and move it to your marked position, change this to a 10 by 12. Make sure you're on the mid-sagittal plane here, and then we'll go to here. And what was the centering for a AP sacrum?
15.
Not the angle, what was the centering?
3 inches below symphysis pubis.
Not below, no.
That's the same spot, same angle. 15.
The symphysis is superior to the symphysis pubis.
2 inches superior to the symphysis pubis. So we can find his greater trochanter to check that. Right there. 2 inches above. Because they all overlap as you go down. And then your coccyx is a 10 to 15 degree, usually on the 15 side, just depending on the angulation of the coccyx. And the centering is identical. And so all we're going to do is mark where we centered it. Change this angle back to 15. And get the exact same centering there.
Okay.
Can you start from the lumbar again? So you held his iliac crest to go into the sacrum or the coccyx?
Yes, here. So we're taking a 14 by 17 of the lumbar spine. Okay. Understanding the anatomy you're trying to present, you're going to get to from like T10, maybe T11, down through the mid-sacral region. The mid-sacral region is where we need to be centered to get the AP sacrum. And so when you're flowing through an exam, or if you get like an TspineLspineSacrumcoccyxi series, you know, you can sit there and repalpate, but you really don't have to. Because as long as your AP lumbar is centered correctly, this line is going to be his mid-sacrum. So all you got to do is mark that put your angle on, center it, and then readjust your collimation back to a 10 by
And
12.
that's the sacrum.
That's an AP sacrum.
Okay. And then for the coccyx, you said just hold it right here. And
Yep.
then just
Mark the
change the
same
angle.
spot. Change your angle to 15 and move it down to the exact same center.
Okay.
Boom, boom, boom.
And that is T-spine through the coccyx APs.
Okay.
The SI joint is a little bit different because we need to be centered more towards the ACIS. So it's actually a little bit more than 2 inches because we're talking about the top of the sacrum. And so if we just find the ACIS here, I'm going to feel the front of your hip, okay?
Okay.
So if we find the ACIS here, we need to be centered just inferior to that on the top side because we're going to be at a 30-degree cephalic angle, much, much steeper.
Do you need another Rice Krispie?
Hmm?
Do you need another Rice Krispie?
No. Coughing on my own spit today.
Ah. Hey, when that happens.
There it goes. Alright. And that is your APSI joints. Important reference here, I don't think y'all saw me do it, but this switches. Okay, so it's no longer 10 by 12. I switched it when I was angling, but it's a 10 by 12 the other way because you just want both of them right here. Right? So that's all our APs. The sacrum and coccyx obliques are 30 degrees. And then as you move up the body, you go 30, 45, 70. Alright, so grab me the sponge over there. Our centering is going to be directly 1 inch medial to the upside ACIS. Roll that way real quick. Roll back on that. Okay, so that's 30 degrees. So find the upside ACIS again. Directly 1 inch medial to the upside ACIS, which is there. Okay? So that's your 30-degree RPO for the left SI joint. And then you do the right one, you would switch it to the right side, and the right side would be up. And now we're going to move up to the lumbar spine, which is 45. So we're going to have him roll a little bit more. Push this a little farther under him. There you go. Roll back. There's his 45. This arm rack is behind him. We're up there, that's fine. And the easiest way to tell where this one needs to be is to find the exact margin of the iliac crest. And you're going to go just inside of that, about an inch.
Okay.
Because that's the way the spine curves. This changes back to a 14 by 17.
Wait, what did you just do?
So where his iliac crest is, it starts rolling forwards. You're going to be centered just immediately to that, or 2 to 3 inches from the mid-sagittal plane.
Okay.
Because you're centering for the spine, which is actually down here. So you're going to be way on the upside of his body to get the spine right there. Alright, so that is your 45-degree RPO for the downside zygapophyseal joint. You're looking at the downside, the right side on this one, okay? And now we're going to move them up into a 70-degree. So now what I do is I roll them all the way on the side. Move back towards me a little bit. Keep going. There you go. So get him in a true lateral position first. And then I'm just going to lightly put this here. And I have him lightly roll back on that. This arm's going to go straight above his head for this one. And this one, the farther you move towards in a degree, the more you have to move towards the lateral side on an oblique. Because you're taking that position and you're slowly rotating it this way. Alright, so now we're going to be centered at that same T6 margin, going through just anterior to the axillary region into the actual T-spine back here.
Okay.
Alright, and on this one, I would recommend widen this out to about 12 inches or so, just because of the curvature of the T-spine. Alright, so this is your 70-degree RPO for the upside zygapophyseal joints. So that's going to be for the left side. All right, and from here we can rotate into a true lateral. Rotate all the way on the side. All right, I want you to scoot back towards me a little bit. Bend both knees a little more. All right. There you go. Straighten out your back here a little bit. Lateral T-spine, still centered at T6. So if we find the C7 for a chest, that's 6 to 7 inches. For a T-spine, it's a little bit less. Okay. Alright, and you want to be centered in the middle of the curve of the T-spine.
Okay.
So the T-spine starts here, it comes out, and then curves back into the body. So it's following this path here. You're going to be centered in the middle of the curve.
Okay.
It's going to completely depend on the difference between patients. You know, if they have a lot of curvature, you have to adjust accordingly.
Okay.
Alright, and this one is again on expiration. Everything with the spine is on expiration. So this is lateral T-spine. An important reference is that you always have to take, in 90% of places, you're going to take a swimmers with a T-spine.
Okay.
Because this region here, from T1 to T3, is always occluded by both shoulders. You have a straight on T-spine, and then you have an angled one. I always use the angled one. If you're ever asked to do the straight on, it's the same thing. You just don't put an angle on. I do a 5 to 7 degree caudal angle towards the feet. You're going to center directly at the T1, C7 T1 junction. This changes to a 10 by 12. This arm is going to drop completely down to the side. You're going to make sure that they relax it all the way. This arm is going to go straight above the head. You want to bring it back a little bit behind and center directly at the C7 T1 junction.
Is this going to be on the bump?
Yes. And that is your swimmer view for this mid-region here. This is the same swimmers that you read about in the cervical series in case you can't see C7T1. It's the exact same swimmer. Alright? Both arms back in front of you. So now we're back to a 10 by 17 for this one. And we're centered directly back and 1 to 2 inches above the iliac crest. Just like that. Deep breath in. Blow it all the way out. Hold, expose, lateral L-spine. Alright. The other specials, just like the C-spine, when you read about flexion extension, we also have flexion extension of the L-spine. The flexion extension views, you keep everything pelvis down, still, and you want to flex them with only their back. So you're going to, I usually place a hand here, and then I rotate their shoulders back. There's your extension picture. Now you want to make sure they don't do this. See that? So you want to pull this shoulder back equally with the other one.
Don't break.
Yep, and actually flex that backwards. Give it a little bit more collimation out this way. And there's your L-spine extension. As you can see, his spine is now being extended. And then the other one, you get them to kind of go into the fetal position. And there is your L-spine flexion.
Okay.
Still lateral position. All you get them to do is put pressure on the anterior and posterior aspects of the spine. Relax for a second. Then we have what we call an L5S1 spot.
That's what I was.
Easiest way to find this is to find the iliac crest. Drop your hand down. Angle it until it's at the point where your thumb meets your hand. Until it's at that point, and your collimation changes to a 6 by 6. There is your L5S1 spot. Hold your breath. Expose. That exact centering is the point for the lateral sacrum. You do a little bit lower and a little bit more outside to get the coccyx, but we do a sacral and coccyx series in one picture, so it's an amalgamation of both. You're going to make this a 10 by 12. Your centering becomes 2 inches directly behind the ACES, 2 inches down from that point. There is your lateral sacrum and coccyx.
Okay.
Alright? Go ahead and roll back on your back. And that is the entire second cup. Okay.